Hello, my name's Rob and I'm the lead Chief Executive for the West Yorkshire and Harrogate Health and Care Partnership. As a partnership, we want to have a more representative leadership right across every organisation in the partnership. It's enshrined in our 5-year plan that we published in March. Coronavirus has shone an even harsher light on the inequalities that persist right across West Yorkshire and Harrogate, and we know that some communities have been affected more than others. That's why I'm delighted during Black History Month that we're publishing a report into how COVID has impacted upon different communities and the steps we can take to make that better. Quite a lot's happened since the last time I did a video blog, so I wanted to give you a bit of an update on where things are today. Here in West Yorkshire and Harrogate, we have 4 local authority areas that are under some form of restriction due to the prevalence of COVID. It's important to recognise that the increase in prevalence has occurred quickly and that we all need to act to control the spread of the virus. Washing your hands, covering your face and keeping a reasonable space of at least 2 metres between people is all essential. Across all of our services, we're trying to make sure that as much care is available to as many people as possible. Services like primary care, mental health, our A&Es in hospitals have always been there for you, and increasingly we're making sure that elective surgery and other services are available too. This is a balancing act as we try and make sure that we have services that are safe for COVID patients and services that are safe for everybody. That means sometimes we have to use digital services to meet people's needs or the telephone. That's okay in a number of cases, but for many people, they'll need face-to-face care. And rest assured, our fantastic GPs, our mental health services, our hospitals, our social workers and others have been making sure that people get face-to-face support when they need it. As we get into winter, we need to make sure that we continue to keep you safe and all of us safe. One of the big parts of that will be the flu campaign. We have a fantastic evidence-based intervention in tackling flu, which is having a flu jab. As a Trust Chief Executive, I'll be trying to build on the 80% of staff who had a flu jab last year and get as close to 100% as possible. And I'd encourage everybody in an at-risk group to contact their GP or pharmacy to arrange to have a vaccine. Please do so because it will make a substantial difference. As we get into winter, communities and the connection between communities and people will be more important than ever. Now, we may be keeping in touch with each other differently, but that contact is essential. And our loneliness campaign, looking out for our neighbours prior to COVID, showed the power of neighbours working together. And one of the things that's become really clear through the COVID pandemic is the power of our communities. Looking out for our neighbours, we'll be starting again soon as we continue to ensure that people support each other during these really difficult times. We've been working with our community-based organisations and with carers to make sure support is available to community groups and to carers. We've already invested over £500,000 in third sector organisations to work in communities on inequalities. And we've provided additional support for carers right across West Yorkshire and Harrogate. I'm looking forward to the next session of our third sector resilience group. There are some fantastic international speakers coming to talk about their experiences and the impact that the third sector and community groups have on our populations. Rest assured that we're working as hard as we can right across the partnership to make sure that we keep people safe and well, and that we work with you in your communities to improve the outcomes for local people. Part of that is working with our councils on economic recovery. We're doing that. Part of that is about working with our universities on skills and development. We're doing that. And part of that is about focusing on the green agenda and sustainability for future generations. I'm really looking forward to our climate summit, which is coming up in a couple of weeks' time. And we'll be able to hear from national and international speakers and set out the work that we're doing to sustain a future for all of us. Please do take care of yourselves. Please make sure you understand the local rules around restrictions in your area. We're working with councils to simplify all the arrangements so they're clearer and easier to understand for everybody. If in doubt, wash your hands, cover your face, and stay at least 2 metres from people outside of your bubble. Thanks for all you're doing to keep yourselves, your families, and your communities safe.